Welcome to our podcast on homelessness in Placer County. I'm Bonnie Gore, and I serve on the Placer County Board of Supervisors. I represent District 1, which is primarily the city of Roseville and the unincorporated areas of West Placer County. Placer County has about 417,000 residents, and of those we have about 700 residents who are homeless. Placer County has the lowest rate of homelessness in Northern California, and our goal is to drive that rate even lower. My goal is to inform and educate the community about the good things we're doing to address this issue, and also discuss the challenges we face.
The homeless crisis in America is out of control, and nowhere is this crisis more apparent than in California.
Even in smaller suburban cities like Roseville, the number of people living outdoors is on the rise.
If we were to act now and strategically, I think we could make Roseville the model for stop it before it gets there.
I'd like to introduce today's guest, Nick Golling. Nick is with the Gathering Inn, one of our nonprofit organizations that works with Placer County. Nick serves as the Chief Program Officer at the Gathering Inn, a comprehensive homeless services agency providing permanent supportive housing, medical respite, and emergency shelter to our homeless community. Nick began his work with people experiencing homelessness as a volunteer while attending college. From there, he fell in love with the idea of providing the tools necessary to address barriers to housing and reduce homelessness in communities. Nick has worked in both the private and public sector to improve overall homeless response systems in several communities. Most recently, Nick oversaw the City of Sacramento's Department of Community Response, a third arm of the local first responder system and the first of its kind in the region. Now my conversation with Nick Golling. So Nick, now that we know you have worked with other jurisdictions, what are some of the operational concerns you have about how other communities are addressing homelessness?
So it starts with one word, and that's collaboration. Operationally, there can be issues with other communities when you have multiple stakeholders that are at the table and they're not speaking the same language, they're not necessarily working together. With homelessness, everyone is a stakeholder, whether they realize it or not, whether they like it or not. So that's the community at large, the public sector, the private sector, businesses, the healthcare system. So when those systems aren't talking to one another, you have operational issues. So that's first and foremost something that can be a real hurdle to jump over in some other communities. And then secondly, there are some communities, there's a number of communities that have taken a look at one specific approach and decided this is the approach for homelessness. This is how we're going to end the crisis. This is how we're going to reduce the problems that come along with that. And I think that it's a missed opportunity when we think that just a one-size-fits-all approach is going to be the solution, because we know that someone's experience of homelessness it's like a fingerprint. It's not all the exact same story. It's not all the exact same person or the exact same background. And so we do ourselves well in a community when we think of multiple types of interventions where people can really jump in at the point that is most suitable for them so that they can minimize the amount of time experiencing homelessness.
That's really good. Collaboration, definitely needed.
Yeah.
And then multiple approaches, not a one-size-fits-all.
Correct.
Great insight. So what do you think our county, Placer County, can do to address these issues that other counties aren't? And I would say we're addressing collaboration as best we can. But some of the other items you talked about, multiple approaches.
Yeah, so, and again, it does start with that collaboration. I appreciate that you brought that up again because this community does collaborate in a really functional way. So we're already kind of halfway there with relationships and mutual respect and mutual understanding of different perspectives and honestly different roles that others have to play. So one of the ways that we can lean into that more is to look into what we're doing now and what's working with it, and also look into what could be better, right? we pride ourselves in being a community here that strives for excellence and that improves the quality of life for all of our citizens. And stagnancy is not part of that mantra. Looking at what is working, leaning more into that, and then also considering other approaches in a changing environment and a changing world that will best serve us, I believe, as a county as a whole.
I absolutely agree. Great. So you've got extensive experience here in Placer County, but also in Sacramento. So can you tell us about maybe the differences or similarities in the homeless population of the two communities and what solutions have and haven't worked well?
Yeah, some of the key differences. So Sacramento County has a very large urban core. It is a metropolis, for lack of a better term. And Placer County, while we do have a core here in Roseville, it's also a largely rural county. And homelessness can be divided a number of ways, but urban homelessness and rural homelessness are a little bit different. So as homelessness as it relates to rural communities, you tend to have people that are much more bonded to specific areas where they have meaningful connections. My Aunt Sally lives down the road and I can still get mail there sometimes, or maybe I can catch a meal with mom and dad every once in a while. But otherwise, that's kind of, the extent of the current relationships that they might have with family or friends. So they feel a bonding to that area. With urban homelessness, it's a little bit more nomadic, where you might be finding yourself drawn a little bit more towards some of those areas where you're able to have your needs met without as much of a specific bond to a specific community or neighborhood.
That's really helpful because we have some of both of that here in Placer County.
Mm-hmm.
We have people who live in the more rural areas, and then we've got more of a suburban feel, like downtown Roseville. We've got homeless in both of those communities, and it's helpful to understand, especially those who might live in more rural settings, have a connection to that community in a lot of ways.
Right.
So now let's talk about the Gathering Inn. The Gathering Inn, we have a location in downtown Roseville. Talk about what services are and aren't provided there.
So what is provided at the Roseville location is we do have a resource center that's available 7 days a week, not only to guests of our nomadic program, but also to members of the community who have needs. So it's kind of a hub where if you're in need in the community and you need to get into stability or safety, or you need resources to improve your current situation, you can find it there. We serve close to 70 people a day at that program. Other things that we provide there are a clothes closet. There's also a medical clinic. We do try to collaborate with other providers that have resources that we may not have. So you can find other service providers there. You can find clinicians with the county coming through and providing assistance and other things. So that's some of the things that are provided. What's not provided there is a place for people to be overnight. It's a location that is, the size of it is such that we wouldn't be able to provide overnight accommodations for a large amount of people. So overnight accommodations are not provided. So technically that site isn't a 24-hour location, but it is a location that can be available during the daytime for those who have the need.
Great, that's really helpful. So it's considered a nomadic shelter, right?
Mm-hmm.
And why don't you talk about what a nomadic shelter is and what services it provides, and do you think the nomadic shelter is sustainable?
Okay, so I'd love to talk about that. The nomadic shelter model is essentially that while you might not have one single location where 24/7 services are provided, instead what you do is you partner with other groups and organizations just to provide the overnight accommodations. So with our nomadic model, the resource center that I talked about in Old Town Roseville, available during the day, and then during the evening, there's a check-in for guests that are going to be staying with us for the night. And then we have a bus and a van, and we travel to a different church within the Placer County community every night of the week where they receive dinner. Oftentimes there's some types of, there's art groups, there's movie night, there's different types of opportunities that the congregations provide for our guests to make them feel welcome and make them feel safe and secure. And they stay overnight there, and then they wake up in the morning, clean the church up as nice as it was when we arrived the night before, and then take the bus and the van back to Roseville to start the new day's cycle of programming at the Resource Center. So that's what it looks like. Some of the really good things about a nomadic model are that it almost invites even more volunteerism within the community, because we're bringing the service opportunity to you as a congregation. So it's an opportunity for people to really have a hands-on experience with providing services for people, and that's been one of the great things about it. One of the things that we see with sustainability is that the nomadic model, we talked a little bit earlier about a lot of moving pieces going on in other larger communities. So one of the issues with the nomadic model is also a moving pieces issue. We have a bus and a van, and we have drivers for those things, and we have people that have to line up and spend time in queue to be able to access that bus and access check-in. Then there's time spent traveling. Then there's time spent deboarding. There's time spent setting up your bed for the night. There's time spent picking it up in the morning. And so all of that time spent is time that's not spent addressing your barriers to homelessness. It's time spent traveling. It's time spent in queue. And so when we look at a nomadic model, compared to a 24/7 single site model. Imagine it's the same thing, but it's just all in one site. There's a lot more time to actually work on generating a sense of stability for the people that we're serving. And when before people even come to the Gathering Inn, whether it's the Resource Center, Nomadic Shelter, or any of our other programs, they're oftentimes living outside. And living outside comes along with it a sense of always being in a mode of fight, flight, or freeze. And that mode, all that you can think about are those three things. It's moment by moment survival. So the more stable of an environment we can provide for people, the more they can relax and feel comfortable and feel safe, and then start thinking about, hey, where is my life right now? What are the things that are missing for me to be able to transform and move into a situation where I'm permanently housed, where I have solid income, where I'm getting back into the job force, whatever it is that may be for that specific household. There's a lot more stability that comes with programs that are 24/7.
And that provides stability for those homeless who are utilizing those services.
Absolutely.
And allows them more time to figure out what next steps are versus moving from location to location stable, and more time to figure out next steps, more time to work on getting a job, having a job at night, whatever that might look like.
Absolutely. Having a job at night is actually a great point that you bring up as well. And of all the years that I've worked with the Gathering Inn, I started working at the Gathering Inn when all that there was the nomadic model out of the Old Town Roseville campus. And that's a real issue when we're working as case managers along with some of our guests, and we're trying to find ways for them to increase their income. That is a barrier that if there are certain types of shift work that they might not be able to access, which otherwise they've interviewed, the supervisor, the hiring manager wants to give them the job, but then they have to think about, when can I sleep? Because I can only sleep during the hours that we have the mats out at the churches. And how am I going to transport there? Am I trying to get this job so that I can get enough income to get myself a vehicle? Well, what the heck am I going to do for a few weeks? And we've done everything you could think of to try to reduce those barriers, and we do as I think as excellent of a job as can be done, understanding that it's an unideal system.
Right. And so let's talk about sustainability. The Gathering Inn Nomadic Shelter has been here in Roseville since 2004.
2004.
19 years. My understanding is it was a temporary solution, right? Let's try something. We need to get people off the streets, especially in the winter. Fast forward 19 years, it's still taking place. And there used to be close to 40 churches pre-COVID that participated in the shelter, having guests come to their congregations. But now it's down to, I think, 22 churches, is my understanding. So you've lost a number of churches, in particular because of the pandemic. 22 churches, is this a sustainable model?
I would say that it is not. We have had a reduction in participation, and it has nothing to do with any lack of a charitable nature or a willingness of our community to give. But when we think about, I mean, particularly when COVID was roaring along, there were concerns with some aging populations we were all being told that it's best to try to keep distance, particularly from vulnerable populations, as much as we can so that we can keep people safe. And we have not seen a bounce back in that time. And I think that the further that we go along, we have groups that are participating and volunteering at the congregate program up in Auburn. And so even the volunteers, I think, are seeing some of that stability of that type of a model, such that the nomadic types of programs that we provide here, and there are some in other communities that work kind of on a temporary basis, as you mentioned, but there's not sustainability with the model over the long term. It's just there's so many inefficiencies just operationally on the provider angle, but then there's also the challenges with where are we going to send people to, and how are people going to be able to really dig into addressing their barriers to housing when they're spending so much time moving from space to space, as opposed to being able to be in the workforce, being able to address other barriers that have created a situation that generated their homelessness experience.
So let's talk a little bit about congregate and non-congregate shelters. What are they? What's the purpose of each? And describe the need, if so, for both.
There's a benefit to multiple types of approaches, and congregate and non-congregate are two kind of larger style approaches to addressing some of those issues. Before COVID, non-congregate shelter was not very common. It wasn't until the pandemic began that people started thinking about programs like Project Room Key or other types of programs where each individual has their own specific space, so that they are not, if they have a respiratory illness, they're not transmitting it to other people and generating in large-scale illness, even when you get like a flu or a cold. So the congregate environment is more of a dorm-style environment where you might have a men's dorm and a women's dorm, and there's a bunch of bunk beds, and people are kind of all staying together. Think about it like sleepaway camp. It's that type of a style, right? Congregate is more of an approach. Non-congregate is an approach where people have their own spaces. That can be their own room in a safe camping type of program. It could be their own tent. Other types of indoor programs, you can utilize partitions such that each sleeping space is kind of its own cubicle, even though it might be in a large open area. And we certainly have found that we like to make lemonade out of lemons. So some of the things that we found through the pandemic on the homeless services side is there's a unique benefit to providing non-congregate solutions to people where they have a little bit more of a sense of personal space and maybe having just even a physical barrier between themselves and someone else, even if it's just in their sleeping area. But there are yet others that really benefit from a congregate style as well. There are folks that enjoy the camaraderie that comes with that, more of a sense of family. Hey, we're in this together because you're my bunkmate, and we can provide encouragement to one another. So again, it kind of goes back to that. It's not necessarily a one-size-fits-all.
That's really helpful. Now let's talk about the mobile temporary shelter in Auburn, which is actually a tent shelter established earlier this year. What's been the feedback from the residents who are living there? What are the tents like? And just share what maybe a day in the life is like for a resident who lives at that location.
Sure. So I'll start with the tents. They are Kodiak canvas tents. They're a 10 by 10 footprint, and they're about 7 feet tall in the center on top. So it's a decent amount of space for even a single individual or a couple. So if there's a couple that identifies as one household, they would be able to be together in that space. It provides a sense of non-congregate to it, so a sense of one's own space. We of course have cots, blankets, and pillows, and then a space for them to store their personal belongings in there as well. The feedback from the guests has been that they are feeling that they are safe. When people are not in a controlled environment where you have 24/7 staff and you have resources to be able to address some of your barriers to housing, again, it's fight, flight, or freeze. And people are subject to assaults. They're subject to all sorts of criminal activity when they're just out in the community. So being in this program is kind of that first nudge towards stability where, hey, you're still in a tent, you're still in an area where your sleeping quarters are outside, but we have indoor space for you to be able to access services and access that stability. And we have staff that are going to be there at any given moment if you have a concern or if you have a need. And we have staff that are really going to be working towards encouraging you to address those barriers and get towards that next phase of your journey towards housing. So it's been good feedback for them. As far as a day in the life, it's a low barrier approach. It's a low barrier program. So what we've decided to do as the Gathering Inn is kind of flood that site and that program with different types of resources that could be accessed. So whether those are life skills groups, whether it's our full-time SUDS counselors, so substance use disorder counseling that's available on a daily basis, case managers that are available on a daily basis, generating other opportunities for people to come together, even for something like art therapy, just to kind of break down the walls that might exist as far as fear of engaging with others or fear of engaging with the system that will help you to transform to that next stage. Those are available on a daily basis. And if guests need to be in a space where they are on their own and away from the group, they're able to do that. So sometimes you've got a lot of people in a room, and if someone is disagreeing with another person, it can generate tense emotions. But having their own space is such that, if they need to spend some time away, maybe they don't get along with John too well today, maybe they had a disagreement about something, they're able to separate and able to kind of depressurize situations and avoid unnecessary needs to have to find other locations to stay.
So it sounds like you provide all types of services there, mental health services, substance abuse services, job opportunities, helping connect people with jobs, right? So do a number of the residents who are at the mobile temporary shelter have jobs, or are they working towards getting a job?
Yes, we do have a number that have jobs. We have some that are working towards that. Up in that Auburn community, people who don't necessarily engage with the homeless services system might not be aware that a lot of the retail spaces that they're shopping at, or the restaurants that they're going to eat at, they have people that are staying in our programs that are working at those establishments, working on building their savings, working on building their job skills so that they can get back on their feet. So absolutely, we do see that there. We also see that program as a transitory program too. So maybe for a specific household, this might be the spot where I'm going to come in and gosh dang it, I need to address my substance use issues. And there's an opportunity to address those issues. And then they're able to stabilize and move on to maybe another program that's a little bit further along. So maybe they would move into a program that is considered a high barrier program that requires sobriety. And they might get into that space where, I'm really needing that accountability that comes along with that, and that camaraderie that comes along with that sense of this is a community of recovery, and they move on to that, which then on the back end of that generates flow through the system. So as there are other people that are out in the community in unsafe conditions, they can come in and then access that.
And you bring up a good point. These emergency shelters are not meant for long term.
Correct.
So what's a typical stay of somebody who comes into an emergency shelter?
Yeah, so generally it's between about 90 and 160 days for people. Some people are staying for a couple weeks at a time. So they have very few barriers, that just the floor fell out from beneath them. They need somewhere safe to be, and they need a little bit of support so that they can stabilize and get back into the community. Other people have significant barriers. They've been experiencing homelessness for a very long time. They have a number of health conditions that they're working through, a number of disabling conditions that they're managing, and they're really starting at square one. So some of those folks can take a little bit longer, which is why we kind of we'll look at everyone served through every program and try to get an idea of kind of what's our average range, and that's what we found.
Great. Let's talk about residency requirements.
Mm-hmm.
A lot of folks are concerned that if we build some type of emergency shelter, people will come from all over the place and come stay in these shelters. So what type of residency requirements do we have at the shelters?
Yeah, so at our programs, we do have a requirement for people to currently be Placer County residents, so some meaningful connection to the community. Are they receiving their mainstream benefits through Placer County? Are they attached to a service provider that's providing behavioral health through Placer County? Were they most recently living at an address that was within Placer County, or do they have other reasons such that they are required to be in Placer County? Do they have connections to our partners in the probation system or the parole system? So we do have requirements as it relates to a proof that one is currently not just I slept in Placer County last night,
right,
but I have a meaningful connection and a need to be in this community. And we found that has helped to curb some of those concerns about people coming from other communities. And I also think about the DeWitt Center programs that we have right now. I think about our congregate program, and I think about the mobile temporary shelter. And that campus has not looked better in years as it relates to people experiencing
right,
unsheltered homelessness. So what do you know? We build programs that people are able to access. We build programs that are going to fit their fingerprint that they have right now at that moment, and then we don't have people experiencing unsheltered homelessness all around the area anymore. So I think that's a really great example. And even when there was some programs in Sacramento that we experienced this with, where there might be a concern that if you build it, they will come, but if you build it right, people will come into the program that are already in your community, and without programming and without stability, and creating a lot of those strains on our systems that we have as far as it relates to the emergency room and law enforcement and other types of effects on our economic engines. We found with that program up in Auburn, both of those two sites has really, you can't find people up there right now that are outside, not connected to services, not inside of a program.
And that's really good news, right? I mean, because what we really want to see is people get out of homelessness. We want to see people address their mental health issues, substance abuse issues, get stable, find a job, move on, right? That's what we want for everyone. And that's not easy, right? That's certainly not easy, but you're seeing success.
We are.
In the programs.
Absolutely.
That is great to hear. So what are some of the other things that you hear about homelessness? Let's talk about maybe myths and misinformation that people think, well, a homeless person is XYZ. What myths might you want to debunk based on your experience of probably 20 years of working with the homeless?
Sure, and I appreciate you asking that question, Supervisor, because it's important to understand where people are coming from and what their journey has been. And I will start to answer the question with just using one word, and that one word is trauma. So homelessness does not exist without trauma. Whether someone experienced severe traumas as a child, in stable households as they were growing up, if that didn't exist, which I can tell you it's very common. I've worked for many years, as you mentioned, in this field and in a lot of direct service roles. I've been face to face with many clients over the years. Trauma is real with homelessness, and if they didn't experience it before they experienced homelessness, I can guarantee you that there are some significant traumas once you do have nowhere else that you can go. So I think that some of the misconceptions that the community can have is that this person just wants to be experiencing homelessness. They want to live free, or this person isn't motivated. They're not motivated enough. And I might look at my situation and say, well, gosh, I went through some hard times, And you know what? I buckled down and I did the best I could in school, and I went to university, and I've got a career going, and I'm taking care of my family. But it goes back to the thumbprint, right? My experience isn't their experience, and I can't project my personal experience of having a pretty stable household growing up and having resources and safety nets that are there that other people don't necessarily have. So it's important for us to understand and to try to suspend some of our misconceptions and think about the fact that there are a number of issues that can contribute to a community where homelessness exists, and you can't find a community in the United States where it doesn't. Here in Placer, we're really doing a great job as it relates to some of our other communities. In fact, veterans homelessness is at an all-time low in Placer County. We're at right around 50 people experiencing homelessness across the entire county that are veterans. We have an opportunity to end veterans homelessness like on fairly short order. That's due to all of that collaboration and all that work, but to bring it back, my experience isn't the experience of someone who is experiencing homelessness necessarily, and my perspective isn't going to be their perspective. These are people that have been through a lot. These are people who have tried their best to find stability on many different layers and many different levels, and they haven't been able to be successful with it. We find that very few percentage of people experiencing homelessness are folks who just are happy to be that way. In fact, I'd say almost zero. Even those folks who might just say, like, I just want to be outside. You actually start to perform outreach with them, and you get to know them, and you get to realize, like, they lost trust in the system because this, that, and the other thing happened. But if I can build trust in them, they're going to realize their value and their worth and their dignity as a human being. And once they have that sense of, because I'm a human, gosh dang it, I'm worth it, then they're going to be able to say yes to accepting supports and leaning into becoming the best version of themselves that they can, while utilizing some of the great resources that are available in this community to help them be successful in doing so.
That's really helpful to understand, right? You can't just necessarily pull yourself up by your bootstraps. Maybe that's what my mom taught me, but when somebody ends up on the streets, it took a lot for them to get there. And they're probably at their lowest of lows, and a lot of times we need some help getting out of the lows.
Absolutely.
And that's the purpose of the Gathering Inn and all the services that are provided. Let's help people get out of those lowest of lows and back into society, right?
Correct.
And functioning well. I think I have one other question for you, Nick, one or two other questions.
Absolutely.
And that is, so what are some of the challenges regarding homelessness that you see our county needs to continue to address here in Placer County?
Well, certainly leaning into solutions that work. Like I said earlier, we've done an excellent job of really looking at what's functional and what isn't functional over time in our community as it relates to all things, but we can look at the microcosm of homeless services and see that that's something that's been done. So some of the things that we can do as we're continuing to look at that is to keep that momentum and to look at, in light of something like the COVID pandemic and the lessons that we've been able to learn through that, look at the things that are working and look at the things that we can see have had an effect that all of a sudden now we're thinking this might not be the most sustainable way to approach things. As we think about, I'll bring it back to that nomadic program that we have, our flagship program, the very first program, and all the wonderful things that have been accomplished through it, and also thinking about all the potential as we think about the way at the Gathering Inn we work to help transform the lives of the people we serve, but transforming the program into something that can actually generate stronger outcomes for people to get into housing and to stay housed. Our mission at the Gathering Inn is to meet people where they are inspire hope, and walk alongside them on their journey to sustainable housing. And everything that we do as an agency is in service of that mission. It's our North Star. And that's something that we do as we look at our own methods and look at ways to hone and to sharpen those. And certainly I think as a greater community in Placer County, looking at the things that have worked and looking at the things that are indicating that they might not be the most sustainable over time. And something like the nomadic model is certainly one to think about.
And change is okay, and change can be good.
Absolutely.
Right? Absolutely, right?
Yes.
Things can work, but they can be done better.
Yes.
And then let's just talk about how our residents can help, right? So somebody is concerned about homelessness. We see it, in our parks, in our creek beds. We have homeless here in Placer County.
Mm-hmm.
So what can our residents do to help?
So certainly there's a lot of great work being done in this community to address homelessness and to reduce homelessness. People can go to our website, thegatheringin.com. There's opportunities there to start to become a volunteer if you haven't yet. We encourage people to come by and assist with, maybe it's teaching a class, maybe it's help with the clothing closet, maybe it's providing a meal, or providing some other service that you can. Engagement with the community in that way is so effective in helping not only our most vulnerable residents to feel that they have dignity and that they have support, but also to help our residents who may be housed in the community to really understand what it looks like at the ground level, and what the face of homelessness is. That's certainly one way that they can help. And then really another is just finding other ways to support, whether it's with one of our many nonprofit agencies that are doing the great work, but also civic engagement. Engage with the public policy that's being worked on and being developed and being executed, and being an active citizen in that way as well. Just leaning into it. The truth of the matter is, whether we know it or not, whether we like it or not, we're all stakeholders as it relates to the crisis of homelessness. And the more that we can lean into that and figure out, well, this is what it is, and we have this issue, asking that question, how can I help? That's the first step.
That's a great way to end it, right? How can I help? How can we as a community, as individuals, help make a difference?
Sure.
And we can point fingers all over the place, right? Failed policies and state mandates, et cetera. But at the end of the day, we have residents on our streets who are homeless. And what can we do to help them and change the situation and really make this place a great place to live for everyone?
Absolutely.
So with that, Nick, thank you so much for your time and your expertise. I think you've shed a lot of light on this issue for me and for our listeners. I really appreciate your time today.
Thank you, Supervisor.
Thank you so much for joining us for this conversation about homelessness in Placer County. If you haven't had the chance yet, please listen to our other episodes at placer.ca.gov/podcasts. While you are there, you can check out the other Placer County podcasts, One Pill Can Kill, about the dangers of fentanyl, and The Placer Life, which shares interesting stories of the amazing people and places in beautiful Placer County. If you want to know more about the work of homelessness in Placer County, please go to placer.ca.gov/Bonnie Gore.